All right, so preventative service recommended for young adults. So no single source of guidelines for young adults. There's Bright Futures third edition, is recognized as a professional standard for care of adolescents and younger children, but it doesn't really talk about young adults. The U.S. Preventive Services Task Force will give some information, and there's professional guidelines that are generally specific to prevention or treatment of a disease or condition. So, for example, the American College of Endocrinology, the American Academy of Cardiologists, the American Heart Association, the American Diabetes Association, they all have guidelines that are generally specific. So like diabetes, you don't start regular screening until someone's 45 unless they have risk factors. So obesity, gestational diabetes, family history of diabetes. Then you can do regular screening before age 45. So Bright Futures guidelines for health supervision of infants and adolescents, 11 to 21. They don't have anything after 21. And then the USPSTF, is the standard for evidence-based preventative services. They have recommendations for less than 18 and greater than 18, and you're going to follow grades A or B. There's no specific preventive guidelines for young adults, period, right? So there's ACOG, which has adult guidelines that overlap with age groups, and that has to do with pap smears. So 5 key guideline areas for screening in general: substance use, so alcohol and drugs; reproductive health, so we talk about STI, pregnancy, sexuality; mental health, nutrition, exercise, and safety and violence. So there's no recommendation. Okay, so substance use guidelines, young adults 18 to 26. There's recommendations to talk about adult or tobacco, but nothing on other illicit drugs, which we know with the heroin epidemic, that's crazy. Screening for STIs, so chlamydia for females. Check if there's risk factors. Doesn't recommend screening for males. There's no recommendation for it, but that's crazy, right? If you know that, what was it, like 52% of males, or what was that crazy number for, not 52, I'm sorry, but the rate of chlamydia and gonorrhea in males is so high, why wouldn't you just regularly screen? And part of it's just there wasn't any, it hasn't been studied yet, there isn't enough evidence, but so the other thing too is if there's risk factors. So what are risk factors if you're sexually active? Okay. Well, first you got to count on someone telling you if you're sexually active. And then also if they've ever had a history of it before. So talk to them about those things. In general, we will check for gonorrhea, chlamydia, syphilis, HIV for this age group if they have risk factors. Most people do. If they've ever been sexually active, you can include that as a risk factor. Mental health guidelines. So suicide screening, there's no recommendation for 18 to 26. That's crazy. There is for depression. Suicide screening. If you're going to screen for depression, you should be screening for suicide. Nutrition and exercise guidelines. Again, so young adults, yep, we do obesity, check cholesterol if there's risk factors, healthy diet if there's risk factors. You should always be screening on a healthy diet. Let's just throw it out there. We live in the United States. We are one of the fattest countries in the world. We can definitely talk about diet. Hypertension and blood pressure, check. Yes, you should. And then physical activity counseling, there's no recommendation. Oh, talking about, okay, family, partner, and violence, that gets asked. There's no recommendation on seatbelt and alcohol while driving. Fighting, helmets, guns, and bullying, we don't do that either. So that's also something to talk about, especially since the #1 cause of death in young males in the United States is homicide. So preventive services for young adults is based on consensus, okay? When ages 18 to 26 years are carved out of established guidelines among specialty groups, there are a broad number of recommendations to inform young adults. So if you look at this, this has all the different things that you could do. So hypertension and blood pressure, screening every 2 years with a blood pressure greater than 120/80. And here's the thing, I just screen every year because people's blood pressure actually fluctuates that much based on their weight and diet. Obesity is everyone. At risk for cholesterol and healthy. So ages 20 plus, you test their total cholesterol, intensive behavioral dietary counseling for those at risk. So that's when you talk about your family history. That's when you talk about, someone's diet. So alcohol screening and counseling, tobacco and illicit drugs, everybody. And those are the different recommendations. So if you go down this list, you'll see testicular cancer. This is a huge one. Ages 18 to 21 are like one of the highest risks for testicular cancer. So we should be talking about testicular self-examination, and the provider should be also doing a testicular exam. So here's all this information. All right, HIV screening, it recommends all. STI, syphilis, for those at risk, NATS, which is now a urine test for chlamydia and gonorrhea. We in our office actually screen males and females from ages 18 to 26. Bright Futures recommends it for those at risk only. Again, I say if somebody's sexually active, they're at risk, okay? Birth control methods. Everybody should talk about it, including men. Pregnancy risk, we obviously talk about that with women who are at risk. Cervical cancer. So cervical cancer screening starts at age 21 plus. It does not start any earlier, and it's a cytology pap smear every 3 years. Testicular cancer, all men ages 18 to 21. Some places actually recommend up to 35. BRCA related cancer. So this is again where we talk about that family history. We talk about breast, ovarian, tubal, or peritoneal cancer. That's for BRCA. So for those with that risk factor, they are going to start mammograms and ovarian screenings early. So CDC recommendation, here are vaccine, meningococcal. So it says at risk. So anybody aged 18 or over is going to be at risk for meningococcal. We should always make sure people get their booster if they need it. Those who are at high risk are those who travel outside the U.S. When I was younger, they didn't really have a vaccine for this, and kids just died, and it was terrible. And if it started at one school, it was kind of like, oh my gosh, everybody go in, and they would get treated after a few kids died. And one day they were there and one day they weren't. It's a very fast and terrible illness. So we give boosters for Tdap every 10 years, HPV, and I know that the age has been lowered when we start that. Varicella, 2 lifetime doses. It's a live vaccine, so obviously we don't give that someone's immunocompromised or pregnant. MMR, influenzas every year. Pneumococcal. So Prevnar is PC13. That is given when they're young, and then you will get it again at age 65. And then Pneumovax, so PPSV23, 1 to 2 lifetime doses depending on your risk. So recommendations for healthcare. Improve preventative care, so develop consolidated set of standards. That's what we need for young adults. Adopt recommendations widely and include these services in quality performance metrics. So making sure that we're doing quality performance metrics on screening for chlamydia and gonorrhea, talking about suicide and gun prevention. So key Affordable Care Act provisions related to young adults. They were trying to enroll young people. That was kind of the big draw, and because a lot of young people didn't enroll, it kind of undermined the whole thing. But there's expanded access, support for preventive services. You could stay on your parents' plan longer. Medicaid expansion went up to 133% above the poverty level. They talked about expanding that to even 200%, but unfortunately, I don't think that ever got passed. State-based insurance marketplaces, so we've talked about that. States must extend Medicaid coverage to youth aging out of foster care up to age 26. Most private plans must offer dependent coverage for young adults up to age 26, and Marketplace have to offer at least catastrophic plans for young adults. And, of course, the pre-existing condition issue.